Dr. Quinn, talk to us about why it's so important that we raise awareness about this topic.
I mean, it is so important. And this is a day that's recognized by the CDC, and for very good reasons. I want to share an encounter I had about a year ago with a patient that I'll never forget. The patient that came in was born a man, but was wearing nice clothing with a dress, hair down, nails done. And my first question for the patient is, how would you like to be addressed? And the patient looked a little confused, and she said, I'd like to be called ma'am. So I walked over to her and shook her hand and said, welcome to our clinic, ma'am. How can I help you? And she shared with me that she had never experienced anything like that. It's always so negative every time she would go to a doctor, by the doctor, the staff, and just to read from the CDC website, that's what this day is all about. The CDC states that in the African-American HIV more prevalent community, there's a lot of discrimination, distrust, racism. And what this day is all about is just raising awareness with the community that's most adversely affected by HIV and AIDS, and increase the screenings, increase the treatments, and decrease the transmission.
As you mentioned, the day is designed to educate, as you've been talking about, and the prevention efforts, and the value of testing and treatment. How would you say that effort is going?
It's going well, and it is so important because HIV is a disease, it's an infection. But if a person is not screened, this person lives in a community where there's a lot of distrust of the medical system. They don't like going to the doctor because they have preconceived and sometimes rightfully so understandings that they're going to be mistreated by the staff and all of the other support of the medical facility. They are less likely to get screened. And when you don't get screened, you don't know you have HIV, then there's a higher probability that you'll be in the community still taking that high-risk behavior because you don't even know. But what the CDC is doing is working with all of the health departments throughout the United States to try to increase screening so people can be diagnosed, and then they know if they have HIV, and then they'll be able to make informed decisions to decrease on that high risk activity and decrease that transmission rate. So important.
Yeah, and a lot's been talked about screening. So how do you get that folks past the idea of going to the doctor or I guess confident about going to the doctor or wanting to go to the doctor?
Well, basically what the CDC is doing with this is they're having conversations with health departments, and health departments are having conversations with medical providers to help us, medical providers, be more sensitive to the populations out there that really need us to be sensitive, to ask the individuals, what would you like for us to call you? And if they choose to be called ma'am, well, ma'am, that's fine. At the end of the day, it's all about helping patients. And I also want to add that the more screenings that we can do, the more that we can get individuals on treatment who have HIV and avoid AIDS. And with treatment, now with the advanced treatments that we have, it's much less likely to contract it to someone else. So once again, that's another just dagger that we have as a tool to decrease the transmission rate and less people get this infection.
And how are we when it comes to transmission rates? Where are we today when we look at that from where we were many years ago?
I mean, we're coming along, but we can't decrease our momentum. We have to keep those conversations going. We have to keep educating our medical providers, including our doctors, nurse practitioners, PAs, and all the way throughout the whole medical chain, and really educate the community and let them know, get screened. If you have HIV, it's not necessarily a death sentence anymore, that the medicine is effective and people can live with it and live very prosperous lives, but they have to take their medication and maintain compliance.
All right, Dr. Quinn, good information out there, and thank you for joining us and educating us this afternoon.
Hey, thank you for having me.